So, next subtopic that we are going to learn is determinants of health. Now, what do you mean by determinants of health? As the name indicates, determinants means those factors which determine the occurrence of disease, or simply what are the risk factors that can cause disease. Now, once you identify what are the risk factors, what is the advantage after that? You can easily identify these risk factors, you can modify or you can even prevent it, and thereby you can always stay healthy. So, there comes the importance of knowing about the risk factors. Suppose you are getting a short note on determinants of risk factors, which is again another competency that is important for your exam. You have to first list. There are 8. Okay. Now, these 8 determinants, let me first list one by one. First is biological determinant. Second is behavioral and socio-cultural condition. Third is the environment. Now, you should be able to think one by one. Then, socioeconomic condition. Then, the health services existing in that area. 6, aging of the population. 7, gender. 8, some other factors. Okay. Now, let's go one by one. What do you mean by biological determinants? Now, you think biology means what you have inside is biology, right? That means if you are born with some problematic or some mutational gene or some chromosome that has some problem, then that can cause disease, right? Some chromosomal anomalies, then Down syndrome, some errors of metabolism. All these are coming under biological determinants. So, you can't do anything about it. For that, you should go into the genetic counseling and such things. Anyway, just keep it in your mind that if you're born with a defective gene or some inherent problem, that can give you disease. Okay. Second is behavioral and socio-cultural condition. Behavioral and socio-cultural condition means, as the name indicates, your behavior has some stake in causing the disease. Do you agree with me? That is how we have the entity known as lifestyle disorders, right? Right. That means how you behave, like if you are into taking alcohol, if you are in the habit of smoking, if someone is taking some drug. Okay, all these can give you a lot of disease. So, that is behavioral and socio-cultural condition. Third is environment. Okay, now what is environment? Environment means everything that is outside your body is environment. Hippocrates is the first person who said that environment has a stake in causing disease. Now, environment, that itself can be a short note, because environment is again divided as per what is given in your Park textbook into 2. One is internal environment and the next is external environment. Internal environment is nothing but, each and every component that is within your body has some stake in causing the disease, that is internal. And external environment, also known as macro environment, is everything that your body is exposed outside. Okay, so that is your external environment. Is it clear? Then we have the next one, which is socio-economic condition. Now, what is socio-economic condition? The society, the economic condition that are persisting in the society and at home can also cause a lot of diseases, under which we have the per capita, GNP, then education, your nutrition, all these are related to the society as well as the economic status, right? The employment, the type of employment that you are doing, then the housing, the political system, all these have got a stake, right? So, that is your socio-economic condition. Then what you have next is known as health services. Now, don't you feel that the health services that are existing in your area can actually contribute to the disease? Do you think so? Just think about developed countries and developing countries. Obviously, a lot of diseases are there in developing countries compared to developed countries, because the health system there is something different. In developed countries, the health system is mainly focusing on prevention of disease and promoting health. So, they are more concentrating into how to prevent the disease. So, their immunization, their water, safe water, their sanitation, their environmental conditions, all these are so good that communicable diseases are very less. Whereas, when you come to our country, or especially in the rural area, we have a lot of communicable diseases. Okay, so the health system, what the services that are given through the health system is also important. Ours is like more of curative. Of course, we have a large component, especially in primary healthcare, which is into the prevention, but compared to what they have in developed countries, I would say it is less. So, the health services, the type of service they give through health system is also very important. Then the sixth is aging of the population. As the population ages, what happens? lot of chronic diseases will be more. That is why, as those countries where old age people are more, then we have a lot of problems which are mainly seen in old age people, like chronic debilitating diseases, disabilities, dementia, Alzheimer's. All these are more in aged population. Then what else? Gender. You know, gender means females. If the health status of females are not given due importance or consideration, there are some diseases which are mainly seen in females, which you will learn under the maternal and child health. Right now, I'm not going into those details. Then comes the other factors. Now, what do you mean by other factors? Other factors mean how strong is the information system in that country, how strong is the communication, how much is the education, the literacy rate of that country. So, all these can also cause, or they can also contribute to the health status of the country or to that community. So, these are the 8 components or 8 determinants of health, which I think you will be able to write by now. Okay.